Well, hello. Today I am excited that Phoebe Boyer has dropped in for a conversation. Phoebe is the president and chief executive officer of the Children's Aid Society and doing just some incredible work that we're going to hear all about. Children's Aid is a nonprofit in New York City that helps children in poverty to succeed and thrive. It provides comprehensive support to children and youth, and importantly to their families in targeted high needs New York City neighborhoods. Phoebe has spent her career making change happen, working at nonprofits and foundations that support educational reform, youth empowerment, and poverty eradication. She's been leading the Children's Aid Society for more than a decade now, overseeing programs that support more than 50,000 children and families. Now, before we get started, I have a little bit of context. This is part of a set of interviews that we're doing to celebrate my great-grandmother, Eleanor Roosevelt, and her deep commitment to human rights. And we thought, as the Eleanor Roosevelt Center celebrates every December the anniversary of the UDHR, we thought we'd find people who are just doing amazing things and try to hear more about them. My great-grandmother was a passionate advocate for children. And I think, although we can hear more from Phoebe, I think there was a connection to your organization, Phoebe.
Absolutely.
That has been around long enough so that we have an actual Eleanor Roosevelt connection, which is fabulous.
We do indeed.
This is the day after New York City has a new mayor, and also in the middle of the government shutdown, just to give the audience some context. And I know that we are in such uncertain times in terms of money for social programs affecting children, and particularly food assistance has been live in the last days, which is so critical for families. So any of our comments need to be taken within the context of that environment. But
absolutely.
Phoebe, just would love to just jump in. Can you help our listeners by telling us what are the most pressing issues that are on your plate for Children's Aid?
Well, first, Sarah, thank you so much for this opportunity. It's really nice to be here, and I appreciate that you have asked us to be part of this celebration. The needs, I could probably be here for days on the needs, but let me back up and just say, at Children's Aid, we describe ourselves first and foremost as an anti-poverty organization, and that's been true since our founding 173 years ago, and it remains true today. Our belief is that every child deserves to grow up healthy, supported, and full of possibility. And sadly, for far too many children in New York City, poverty stands in the way. And I think, again, as we talk about the context today, in fact, in many ways, we're sending more kids into poverty. And poverty is something that threatens children's health, it disrupts their education, and it destabilizes their families. And everything we do is about helping children and families overcome those barriers so that every young person has a real chance to thrive. And truthfully, we see that every day. Our work really falls into what we call four main domains. It's education, it's healthcare, it's social emotional development, and family and home. And we believe when those four things are strong and stable, when kids do have access to a great education, and when their physical and mental health are supported, when they have strong and social and emotional tools to navigate the world, what we sometimes call as resilience and perseverance, and when their families are strong and secure, then they can succeed and thrive. The things don't get in their way. Now, these systems, of course, don't exist in isolation. Each of these domains falls into somewhat of a different system of our government, education, health, social services. Unfortunately, sometimes those systems are often disconnected. So the very things that are designed to help address the challenges of poverty and the challenges that our kids are seeing, they often are disconnected or sometimes even working against each other. So a big part of our work is not only addressing direct needs, but it's also about how we operate within those systems and how do we basically have, I argue often, an expertise and a perspective because we're deeply in those systems. They are our funding sources, they're our policy partners, and we try to operate across them so that we can use that knowledge to deliver more comprehensive supports to kids and families, and also to educate our leaders and policymakers. And that's how we drive the change and address all of these things that are undermining a young person's opportunities.
I love that, working directly and then to get the scale working with try to change the system. I'd love to just hear a little bit more about your arc, how you got here of your career. What inspired you to take on this role, and how did
I think on some level it's a culmination of everything I've ever worked on and learned in my career. But I will say that what drew me to Children's Aid is the comprehensive approach. We say it's a 360 approach to kids and families. And throughout my career, I've worked in different pieces. And I felt like part of my learning was always hearing what I call the yes, but. We could have accomplished X for this child, or this child or this family could have done X had we had more access to. And so to me, Children's Aid was really a culmination of everything that I've done. I've worked in government. I've seen firsthand how those systems are designed really with great intent to solve the problems of our residents. But again, they are often in silos. Everybody is working hard, but I think sometimes the lack of coordination can make it incredibly difficult. There's sort of an unintentional conflict. One division of government decides on an initiative without realizing all the other people it's touching. From the time I was in philanthropy, again, I worked on a lot of education, by funding a lot of education organizations, and everybody was doing excellent work, but it was a single solution. Yeah. And poverty is incredibly complex. There is not, we'd love there to be the one silver bullet, but there isn't one. And there's no one size fits all. And I think what I've learned throughout my career is that programs that have the greatest impact are those that recognize how interconnected a child's needs are. Mm. And in human services, which is what we are, you see up close the daily realities that children and families face and how essential a holistic and coordinated approach is. So I think when I was approached about coming to Children's Aid, it seemed like all of the things I'd ever worked on all in the same place. It's part of what's powerful. I had a mentor once say to me, well, you do like complicated. I do like complicated, in part because I think that's some of our superpower, right? When we're working across, or it's not just that we're working across these different systems, we're really knitting them together and understanding that education it has to be connected with social and emotional learning. It has to be connected with health and family stability. And so I think when we integrate them all, that's really what is that comprehensive, integrated, and ultimately transformative approach. It's frankly what our families deserve, and it's what changes the outcomes for kids.
Yeah, so true, but also just super hard to do, super hard to get donors that want to back that.
That's super hard. But I think one of the things that's powerful about being 175 years old is that we've been innovating all along the way.
Yeah.
Being in different places, working with different populations that needed us most. But at the core, it's about providing the supports that kids and families need to be successful.
Yeah. Yeah. One of the things I talk about that my great-grandmother had a sort of genius for was being, which is something that you mentioned a couple of times, being this sort of bridge between, understanding actually, in the community what people's needs are, and then translating that up into however many agencies in government or whatever programs. All of them. For and as you said, poverty has this incredible complexity to it, and I wonder if we could hear a little bit more first about the direct to families piece. So sort of what, tell us a little bit more about what Children's Aid does in terms of services and what it looks like in the community when you are there helping.
Yeah, I mean, in so many, I mean, I think truthfully, in so many ways do we provide the support to families. I mean, and I have to say, like, it's such an honor to be able to talk about Eleanor Roosevelt with you, in part because I do think that that direct service and policy piece, that being proximate, is so important. The how we think about this is about the partnership with families and what do they need. And so when you're in the way we are, when you're in the communities, when you're working alongside with families, when your staff were former clients who become our leaders, that is really powerful. But you understand that children and families need what all children and families need, right? That's food on the table, a safe place to live, access to health care, a good education, opportunities to learn and grow in school, outside of school. And most importantly, every child deserves that caring adult who believes in them and helps them imagine what's possible for their future. And those are universal things. And I think what we are seeing now is so many of those supports are being pulled from families that are fragile. They were fragile to begin with, and we're making that harder, right? And I think, that also results in a loss of dignity. Sometimes, not sometimes. As a society, we often blame, right, or demonize people living in poverty about, making bad decisions. But I think when you start to unpack the choices that people have to make, what they're not choices, they're forced into really untenable situations. And if you placed anyone in those situations, they would make some of the very same, ultimately sometimes risky decisions, because there are situations of impossible choices. And again, I think, we're at a particular time where we're making that more vulnerable. The cut to SNAP is dramatic, and it is being felt by people who are living paycheck to paycheck, who are going to be making choices about being able to feed their family or being able to stay in their homes. These are the impossible choices that we see every day. I think what's powerful about being at Children's Aid is that we've actually been in these communities. We're a deep partner. Our roots, as we say, are deep and they matter. We are trusted, which means when somebody's feeling vulnerable, they come to us and we can help. Sometimes we're just standing right there by their side, no matter what, listening to what they need and figuring out how we remove the barriers. Our approach is really collaborative. We're working with families, not for them. We know that every parent wants the best for their child, and our job is to make sure they have the tools and resources and supports. And when that parent can't, that we make sure there's a loving, supporting adult in that child's life.
So let me take you back to the policy and the program side. I loved the way you described the different agendas or decision making in different agencies, and it's not as if it's intentionally blocking, but the silos and how important the coordination is. But I'm curious what the right now in terms of coordinating across and the kinds of things that you talked about on the policy side.
Yeah, so I think we as an agency are very committed to working with our government partners, and part of that is we have deep experience. We want to share that experience with our policymakers so they make better decisions that not only benefit the children and families of Children's Aid, but all children, right? I mean, we have, I think, as an organization, and we sometimes say we're an anchor institution in this city, right? We are part of the fabric of this city and part of the safety net. It is also part of our responsibility to help change practice and policy so that it impacts children and families across the state, across the city, across our nation, not just the ones that we happen to serve in the community. So with that commitment, it means that we are a partner to our government agencies. And in our organization, we work at the city, the state, and the federal level. Much of what we do sits at the intersection of those systems, right? We're in the education system, we're in the healthcare system, and we're in child welfare. It gives us a really unique lens to be both in those systems and to be outside. And so we operate schools in partnership with the Department of Education. We run health clinics that are licensed by the Department of Health. We collaborate with the Administration for Children's Services, which is the foster care agency, to support families through the entire continuum before they get into foster care and then during when a child might be in foster care. But it's that we know where those systems succeed. We understand how they operate. We know how they succeed, and we also know where they're falling short. And so we try to use our expertise to deliver better outcomes. Sometimes we're leveraging a public dollar with a private dollar because we know that public dollar isn't doing enough. And we can then go to our government partners and say, there's a better way to do this, and let's work on that together. As I said, our goal is not to just impact the kids in our responsibility, but to really create systems that help all children. I think sometimes it's also a balance. Government has an accountability to the public. I'd like to see more of that right now, given the context we're in. But that means that they sometimes see shorter timeframes, and we want to help them understand the longer term outcomes of their work. To make sure that the policy and the funding is supporting the holistic approach that we know and have evidence to show builds stronger communities and results in much longer and better outcomes for children and families. And I think that's it's both like being a critical partner and a supporter and a critic, because we're going to push them to do better. That's and that's the power also of being a nonprofit. We're slightly outside, but inside. And so I think it's super helpful when we can partner and push back and show evidence and let our young people tell their stories too.
Yeah.
They're the most powerful advocates we have.
Yeah. So 170 odd years old.
173.
173. I think the story with my great grandmother is that in 1933, the Children's Aid Society established something called the Housekeeper Service Program. And you can give me the fuller story if I don't have it quite right. But I think Eleanor Roosevelt served as the first chairwoman to that. And it was a sort of mother's helper for families when the mother was not well or had to leave home, and laid the groundwork for some of the Children's Aid preventative services. Is that right? Do I have the connection right?
You have that absolutely right, Sarah. Your great-grandmother's connection to Children's Aid is a remarkable part of our history. I think her leadership of what was then called the Housekeeper Services Program, I think, as you've said, really embodied what she stood for, right? This compassion in action and a deep belief in the strength and resilience of families. That program, which now is known as Homemakers, was groundbreaking at the time because it recognized something pretty essential, which is that the best way to support families is before they reach that crisis, before a child needs to be removed from their home. And that's the philosophy behind what we now, not just in New York, call the preventive programs, right? They're supports for families before designed to keep a child in their home and to navigate the challenges like illness and domestic violence and other hardships so that that separation does not occur. What's fascinating is we still run that program to this day. It still remains a key component. And I was talking with some of our team earlier today. When a child is returned, having the homemakers program is an additional amount of support that allows for reunification to be easier and to be lasting, which is of course what everybody wants. But I think it's, this component of our program, it allows us to be really close to families and to understand what they're facing. And that proximity allows us to just design different solutions that are practical or relevant and make a lasting difference. And sometimes those early models are the very models
Amazing.
that we're still doing today. And so her legacy, Eleanor Roosevelt's legacy, absolutely lives on at Children's Aid. I think her conviction that families deserve both that empathy and that practical help continues to be shaping our work.
Yeah. Wow. So sometimes I ask people who do this kind of work, it's hard work. It's working not only with the complexity. I know you said you like complexity, but the complexity of poverty, it's hard to have that as your universe that you step into every day. There aren't easy wins, and there's by its nature and what you're doing every day. How do you stay motivated? How do you keep from being overwhelmed?
Yeah, and I won't say that I don't have my moments of being overwhelmed. I think we all do, and I think it's also that support to be in it with this particular group of people here at Children's Aid. But I think part of what's always motivated me were our kids and families. It's really their resilience, their courage, and their potential, and it's inspiring. I was listening to a young lady who was in foster care with us be interviewed. We've been a recipient of the New York Times Foundation support, their community fund, for years. Well, for about as long as we've been in existence. And I was listening to this young woman be interviewed by Nicholas Kristof, and had been in foster care. She graduated from Columbia. She's at NYU studying to be a social worker. Her entire trajectory has changed. I say I meet people who are Children's Aid kids everywhere. There are surgeons, there are principals, they are our police force, there are community school and community center directors. My favorite words are, I was a Children's Aid kid. And I hear it in all sorts of settings, but it is them, and it's also the incredible staff. They inspire me every day. We are facing obstacles that when I think about even just the last 5 years between the pandemic and now this really challenging situation. Yeah, the challenges can keep piling up. The budget constraints and the complexities of issues are extremely real. But I have to say, I can't imagine being in a position where I couldn't make a difference.
Yeah.
And I think that's what allows all of us at Children's Aid. And again, we're not being naive about what we face, but when we can move something forward, even if it's for one family on one day, that's what gets us up in the morning. And we're going to continue to push through no matter what.
Yeah. Yeah. Let me ask you another sort of personal question, which I just like to ask because I'm a big reader. I always like to ask, what's I used to say what's on your bedside table, but now we don't read with books on our bedside table. We read everything electronically.
Don't tell my husband that. He's got a stack.
Or was the to be read stack that used to be there?
Sometimes it's the multiple. He's reading all of them.
Stack. Exactly. What's either something that you just love that you're reading now, or a book that really changed how you think? I'm always interested to know.
Yeah, it's interesting. I'm a big fiction reader because I love to put myself in somebody else's shoes. And so I love to learn. And it's interesting. I have recently read The Women, which is about women nurses returning from Vietnam. I don't know if you've read that.
I haven't read that one, but I've seen
Kristen
it. Yeah.
Hanna. It reminded me about sort of how far we have come as women, and yet how far we still have to go. But I had not appreciated how invisible women nurses had been during that time in terms of repairs. And so I think that invisibility thing keeps me going. The other piece that I've read recently was Ezra Klein's Abundance.
Yep.
And there's lots of information in there and good perspectives, but I think I'm trying to hold on to, we have built a lot of barriers to actually accomplishing some things. So how do we think about freeing ourselves from some of those barriers and working differently? And so I'm trying to hold on to that as well.
This has been so much fun and just such a pleasure learning about what you do, Phoebe. And one last question. In all the inspiring work that Children's Aid Society is doing, we are in such turbulent times. I'm just love to hear kind of what are you hoping for? What is, if we could make some things turn in the right direction, what's on your mind?
Well, so first of all, thank you, Sarah, for having me. It's I've enjoyed our conversation. I think when I look ahead, what I'm hoping we will see is more people stepping up with more empathy and compassion and really understanding and engaging with our families and communities and the issues. I think at times we've taken things for granted, like some of the supports that we as a society said we wanted. And now to be able to provide food and healthcare to people. And I think in a crisis, it helps people understand really what we might be losing. And when, again, there's just a deeper understanding of the real challenges that families face, I hope that as people get more proximate with the issues and pair that with more empathy, that we'll get better solutions and make a real difference together. Individuals of all types, especially Eleanor Roosevelt, helped start this organization when the government didn't provide us with any supports or only a handful of nonprofits existed. And so I'm deeply hopeful that people are going to come together because that's what's going to make a difference.
Yeah. Well said. Yeah. Well, thank you so much. It's been
Thank
just
you.
such a pleasure.
It's been a joy. Thanks so much.